Before you judge a man's life, understand the mind that lived it. We all wear scars you can't see. We all fight battles we don't post. This podcast isn't about perfection. It's about growth, lessons, pain, and power. Welcome to Mistakes Make a Man.
Welcome to Mistakes Make a Man. I'm your host, Dion FOBB REEP, Caracciolo, and today we're bringing health information to our community because we all know it's a killer. I'm going to let Ms. Baldwin introduce herself and give you a little bit of her background, and we'll go from there.
Dion, I would like to thank you for inviting me today to help spread knowledge related to the health issues in our brown and black community. I believe knowledge is empowerment, and that be able to make you better choices when you help deal with your health issue. My name is Wenonah Baldwin. I've been a nurse for 30 plus years. My specialty is cardiac, and I am the equity RN. I have been involved with different community services, teaching the community around the DMV area on heart issues, breast cancer, and also big into black female heart.
Okay. All right. Well, we're going to jump right into this. What is the biggest killer in our community health-wise and why?
Well, health-wise in the black and brown community, especially black community, is hypertension. Is our number one killer right now. It's not because of not wanting to be compliant with our medication. It's a lot of deal with racism, our environment that we live in, and also just the pressures of daily trauma that we face as being a black man or woman out here in the world. So with hypertension, we are 2 to 3 times more to pass away compared to our white counterpartners based on just not getting the proper wise care, first of all, from certain facilities and racism. And what I mean by bias is that they don't take their time with us when we go into the doctor office. They don't explain things to us properly. They rush us. They don't explain the medication. We always want to say, even amongst, I hate to say black on black bias, when they come into the medical field, we just have this thing related to socioeconomic and educational background that we look upon blacks and will say, well, they're non-compliant, they don't take the meds, and that's really not true. The non-compliance come from lack of income, and we don't go out to try to teach them how to go get these medications at a lower price or anything like that. It's things that we can teach our community that we lack to teach them. So it's not really per se we want to say is a lot of times, black people, we're biological or hypertension. It's really not that. It's a lot of social economical environment. The environment out here in certain areas where we live at, we cannot exercise appropriately. We have food deserts where we have to go to stores that have high sodium content. So it's a lot of things that affect us more. That's why we have hypertension. And when you go to a doctor, you should demand to be have your time and be talked to appropriately and be educated about any health issues.
So why do you think they treat us differently? Is it an income thing? Is it just a race thing? Why do you think they treat black people worse than they treat white people at the doctor?
It's a racism thing. It comes down to racism. It's just a whole racial racism. And they put all the biases, all the stereotypes, everything into it. And so when you get a doctor, some of them have already, they'll look at your information, where you come from, where you live at, and know nothing about you. And I'm not going to say all, because all of them are not there, because I have met some wonderful doctors and wonderful nurse practitioners and nurses and other people in the health field. They already made up their mind how they're going to kind of treat you or come forward to you. So that has a whole lot, and that makes us feel kind of, I want to say, lower when somebody talks to you a certain way. It makes you feel like you're below them. And also, don't ever let anybody do that to you. When you come into the doctor's office, I always tell people when I teach and educate, you have a doctor appointment coming, write down your questions so you'll be prepared. Because a lot of times when we get there, we forget what we really have in our mind to ask, and we forget about it. So I always tell people to write it down. So that constant make them, don't just let them excuse you, make them give you the answers.
Okay. So hospitals you've worked at, you've experienced this firsthand. You've seen it with your own eyes. So you know. And how do you feel as nurse from our community seeing your own people getting treated in that way?
Well, how I handle, I cannot speak for anybody else, and I know a few other nurses do it. Sometimes when we have a thing called rounds, I'm mostly an ICU nurse, so it's a little bit different more than you said a medical surgical nurse or anything like that. We do have rounds, and we do bring things up that do affect the patient, so we all can be in one accord. So if you're at a certain hospital and you know how to speak appropriately and be the advocate for that patient. And I have seen like black on black also have the bias on it. So what I do, I let them handle, but I go behind and educate. I'm big into education when my patient and their family. So to me, as a nurse, we always should be educating.
That's good.
That's
You're
how I
looking
am.
out. You're looking out for your own people. That's good. Okay, so how does stress and generational trauma impact our physical health?
With stress, mental health, and generation trauma. So we have stress when we stressful hormones start kicking in and we start having our cortisol level, adrenaline, and all that, and that involves with mental health also. When you have all this adrenaline and cortisol, which I know everybody hears about on TV, I have a cortisol belly, I have this and that, and that's true. And when you're cortisol, your body is traumatized by continuous like racism, social economic fighting for a job nowadays, how the world is, your environment, just everything is stressing on you. And things that are trying to build into the black communities, like these data centers, and they're changing that, and they bringing things into the black community that change the environment. So our bodies are constantly stressed. When our body's stressed, our mind gets stressed, our mental gets stressed. So that's when our adrenaline and our cortisol start kicking in, and adrenaline affects your heart. Your heart rate starts beating fast. Your blood pressure goes up. Your cortisol fights against your immune system. You have GI problems. And then the trauma with racism, fighting for a job. Then you have that depression, which comes fatigue, overeating, not sleeping well. So all that affects your what? Your blood pressure, your heart, your diabetes, because you're not eating appropriately with the cortisol. You're more susceptible to getting infections because your immune system is down. You're just all over the place. So that's what has a lot to do with stress. Stress is a big factor in our black community now because of everything that's going on.
So I know with me, I don't like going to the doctor because it's always bad news. Like I could go to the doctor for a cut on my finger and find out my blood pressure high or my cholesterol high. And I know with a lot of the stuff you're saying, a lot of the stuff these doctors talk about, we don't know these terms. We don't know what these things mean. So it's really hard to be worried about something, we don't know about. Like I'm only going to speak for me. I'm not going to speak for everybody else. I'm not one of those people that will go research the complicated, gibberish a doctor said to me to find out like, oh, something is really wrong with me. So how can we make things easier and more understandable so people can actually know that something is going on with them and they need to, get checked out, go back for another visit, go for a second opinion? Like, how can y'all simplify these things that y'all say to us?
Well, your body is your indicator something's wrong with you. So never ignore your body. So you're just like everybody else. Every people want to go to the doctor and they say they'll find a finger, you got a cut, but they'll find something else going on. So you have to know your body, first of all. And if that body is giving you signals that something wrong, you need to go to the doctor. And a lot of bias is, well, it's trauma from years and years, how we were been used for guinea pigs, I should say. And that is still in the black community. As I talk to some patients, they do say, well, they're going to use me as a guinea pig. Take, for instance, COVID. A lot of people did not want to take the COVID vaccine because, this is a guinea pig thing. They're trying it out. So, but look at the history of black people, what we did with the syphilis and everything else, and even with Henrietta Lacks, what they did with her cells and stuff. So a lot of us, we have those fears that they're going to give us this medicine and it's going to do this to our body, or they're going to take something from us, or, be a guinea pig. I understand that wholeheartedly about that. But you got to remember, and this is how I tell people, it's only one of you. The way is, I understand definitely how you're talking about how they can break it down for us to understand. And I get that a lot because I have asked patients, you have heart failure. And they're like, my heart's not feeling. I said, did everybody tell you had a weak heart? They're like, yes, but they cannot connect failure with weakness. So there is a disconnect with understanding that certain diagnosis. And please don't be the Google doctor. A lot of us say, oh my gosh, they went to the Google and now they listening to the Google doctor. You got to remember, anybody can type something in Google. They might not even be a doctor. So beware of what you read out there on the media about something if the doctor tell you. And it goes back to what I was telling you, like write your questions down and get them to break it down to you. And that's, you have to demand that. You are, I don't care how you're paying for your visit or anything that this is your body. I don't care if you're on what kind of insurance you have, the top-notch insurance or the government, you have the right to be treated appropriately.
Okay, you have the right to be treated. Okay, I like that. But back to something you were saying about being guinea pigs and COVID. I have a story about COVID. So the first time I had COVID, I went to the doctor. I couldn't breathe. I was coughing real bad. I couldn't even laugh, barely talk. And, they told me I was tested positive for COVID. I had COVID. And I was just asking for simple cough medicine, something, an asthma pump so I could breathe. And they pretty much told me, we can't give you anything because you have COVID. You either survive it or you don't. Now, the second time I got COVID, they explained to me that I had long COVID. I was like, I've never heard of that. They say it's a new strain called long COVID, and they said, we have medication for it. I said, great. So they gave me these blue pills and these gold pills. They said, take the blue pills in the morning and the gold pills at night. I would take these pills, and after 2 weeks, I would feel great. But then 2 weeks later, the symptoms would come back again. Then I would take the pills again, it would go away. Then 2 weeks later, it's like it kept starting over. And I was like, I get it now, long COVID. But what I decided to do, I went on Google and Googled these gold and blue pills. Mm-hmm. And everybody on Google was saying, the more I take these pills, the more I kept getting sick. Mm-hmm. So when I finally stopped taking the pills, all the symptoms disappeared for good. And I feel like that was wrong. I'm not in the medical field, so I can't speak on it. I can't judge, but I felt like, yes, I was a guinea pig. They were testing this new medication on us, or pretty much giving us COVID again to keep us coming back to the hospital because that's how their bills get paid.
A lot of people feel that way. I hate to say. COVID still is out there and has not gone away. The strands are changed. There is this thing as long-term COVID, and people have residual from COVID. Like anything new, we are guinea pigs. The vaccines came out. We really did not know how it was going to affect us. And now, they want you to get different vaccines and they give you the pills. And this is me. I had COVID about a year ago, and they want to give me the pills. I said no.
So you in the medical field refused these pills that they were saying were great for us. Did you get the COVID vaccination?
Yeah, I did get the COVID vaccination.
And how did you feel? I didn't get the vaccination.
The first one, like everybody I know, all the nurses, we were mandated, actually, because you cannot get a job in the hospital if you don't have the COVID vaccine. So you were really mandated at one time to have the COVID vaccine. If not, you were not going to work. So the first vaccine that everybody got sick. I don't care what race you were, everyone got sick from it. The second one that you had to get was much milder. You didn't get sick, you might got a headache. And the third, the booster, no one felt anything. Majority of people didn't feel anything. But like you said, people with long-term COVID, I know some people had the effects of COVID for over a year. And they still have some residual, like the COVID heart, the COVID lung, we say, in the medical field, because COVID had affected a lot of young people with their heart and lungs.
I definitely understand that part because, my breathing, it took a couple months for my breathing to get right again. So I understand the effect COVID has on you and your organs and stuff. But those pills, it wasn't just, the long-term effect of COVID. The symptoms were literally starting all over again.
Yeah, I put it this way. For me, I didn't take the pills. I'm going to leave it like that.
Well, I wish I'd known you back then, because you would have been like, hey, don't take them pills. Okay, all right, let's move on. So what are the early warning signs of diabetes that many of us ignore?
We do ignore our body. Like I said, you have to be in tune with body. So a lot of people, we ignore the basic, like the thirst, being thirsty all the time. A lot of people say, oh, I'm just drinking a lot of water. Or the constant urination, especially at night. That's the key. The urination at night are the two big things. Being tired, more fatigued than usual. The unexplained weight loss if you're not on a diet or taking, GLP-1s now, as we're doing. And it's also having interspurts of being hungry too. So a lot of people kind of say, well, I'm drinking a lot, so that's why I'm urinating a lot. And let me tell you, diabetes is the silent killer of your arteries. So when diabetes is eating at your body and you're not paying attention to your body, your heart is getting affected and your arteries are being eaten at. Because I have a friend of my family who you wouldn't think that person would be a diet, slim, exercise, and everything like that, but it runs in the family. And they had diabetes, and here they had a major heart attack and had to get open heart surgery.
Wait,
By ignoring the signs of diabetes.
diabetes leads to heart attack?
The body is a cycle. So if you stress one thing out, it's going to flip into the next organ.
Oh,
to
wow.
compromise. So diabetes can affect your heart, affect your kidneys.
I mean, I was just about to take a sip of my water, and then you said that. I don't think I even want to be thirsty anymore.
You need water, but
Yeah,
excessive thirst. I want to say excessive thirst, not just being thirsty, but excessive thirst, like you constantly drinking and you don't feel satisfied.
Oh, okay.
Okay.
All right. Well,
Is that made it a little bit better?
All right, I'll get to that in a little bit. Okay. Why do you think so many of us avoid going to the doctor until it's too late? Because I'm one of them. I had a broken thumb for 3 months, and I didn't go to the doctor until my ears started bleeding.
Oh, okay. Like I said, the body tells you, gives you signals, and it goes back to the stereotypes and stuff why people don't go to the doctors. And in our communities, we don't have that. A lot of the Black communities, we don't have accessible health care, like urgent cares. They're very little. Look over the by me, a lot of my community work I do in D.C., more in the Southeast area. Look at Southeast D.C., very limited urgent cares, very limited grocery stores, very limited that. But a lot of it is we feel that bias when we walk into the doctor office. How are they going to look where we live at? They're trying to figure out what we do for a living. They're doing all that. So a lot of us are scared because just of the racism and how the stereotype, and also being the guinea pig again.
So wait, how can I say this? So there's not a lot of urgent care in the Black community because what? Most of them have what? Free insurance?
No.
So insurance
Racism.
Oh, they don't want to deal with us.
Like, take for instance, I'm gonna talk because I know DC. That's a take for instance. They close one hospital and build another one. I'm not going to say the name, but they build one that is very non-functional. So over this east side of the river, they said the mayor promised them a hospital. She gave one, but it's a functional. If you have the DON and CEOs and COOs resigning with a few months after the hospital has opened, there is an issue.
Oh, wow. I never looked at it like that. I mean, where I am now, it's a lot of urgent care, but, I never really drove around the hood. I mean, I don't really remember any being in the hood where I was raised.
Yeah, they're very limited in the suburban areas where Blacks, you'll start finding them in like certain wards in DC, like Ward 2 and 3. That's where you have the mixture of, they said that people have the jobs, the income, the more of the gentrification areas, even though east of the river is starting to get more gentrification, but it's not there yet.
Well, I mean, we did have a lot of liquor stores, though. I know, you know.
And corner stores.
Yeah, most of my mom's remedies every time we got sick was Hennessy, honey, and lime. So I get it,
No, we always had Black community. I was born in the country area in New Jersey. We all had our own medical remedies. It's like I'm much older than you. Mercurocone. We were laughing about that. Mercurocone kills everything. Go get that. Now it's illegal. If people knew iodine put on your child's body when they get a cut, is what iodine does. We wouldn't done it back then, but That's what we did back then.
I actually got some iodine upstairs. My mom sent it to me. She said it's good for swellings and stuff. Oh, Lord. Oh, it's terrible. We need to learn this stuff. Okay, so what health screening should Black men and women be getting, and what age should we start getting them?
Oh, excuse me. So, because there's a lot here. Well, we should start. Well, put it this way: when your parents start taking, it's kind of hard. Well, when your parent or parents start taking the child to the pediatrician, I think we should start teaching them then the points of getting physicals. What is points to going to the doctor, the dentist. Start at an early age, innate it into them. But it doesn't happen because of what? Racism, social economics, the lack of what we have in certain communities that we have. That's where I should start at. But the age of, I have less of taste. Sorry about that. But they say between the age of 18 and 29, that's when we're really supposed to really start going to our primary doctor, getting our, especially if we have high risk in our family of hypertension or diabetes. We should get that yearly physical, our cholesterol checked, or hemoglobin A1C, which checks you out if you're predisposed to diabetes. Girls, we should go to the GYN and get our pap smear, HPV done, and everything like that. So it's between that 18 and the age of 29, that's when they start saying, getting that done, getting your cholesterol checked like every 1 to 3 years. Every 1 to 3 years for your chemistries, like knowing what your potassium and your hemoglobin and all that.
So all that stuff is important?
Yeah, so at an early age. And I'm going to put it out there to people that if you're sexually active before 18, you should go to a GYN doctor. You should be tested for STDs. You should be tested for the HPV. Because, HPV is a precursor to cervical cancer. So if you don't protect yourself, you're at risk for having cervical cancer. And it's passed on to men also.
So the doctor told me last week that my cholesterol was high. He said I need to stay away from fried foods, from butter, from greasy foods. And I don't eat anything fried or greasy or butter. And then he said, well, maybe, you got it from your family.
Heredity.
And the thing is, like, I don't know my family's medical history. So how do I check for something or look into something that I don't know my family have? For the people who don't have a relationship with their family members, how do you figure this stuff out?
Well, if you can't figure out, like you said, you don't know from your family members, or people don't know the past of their family members, you just got to start with yourself. So you already know about the diet. And my vitamin D deficiency, did he tell you about that?
Yeah, he said my vitamin D was low.
So vitamin D kind of helps with that cholesterol, and start eating like the fatty fishes. That will help out a lot, okay? So
can't eat fish, allergic to seafood.
That's right. But I'm talking about other people, fish. So you can get the vitamin D with a K3. Always get the vitamin D with a K3 because the K3 helps the vitamin D gets into where it's supposed to be.
Vitamin D with K3. Okay. And the biggest fear for all Black men, prostate exam.
That's very important.
When do you get that exam?
I think they said start that at the age of 40.
40?
Prostate exams at 40, colorectal at 40. The biggest problem, but the biggest killers, I would say, for Black people is the hypertension, cardiovascular diabetes, colorectal, breast cancer, and prostate. They're the ones that are our biggest thing. When we get it at the highest rate of anybody else. Prostate cancer, which can be curable, men. Very curable cancer if you get your prostate checked out and you take care. If that doctor comes back and tell you you have prostate, get it taken care of ASAP. That is one of the cancers that can be cured very quickly and taken care of.
But the fear is in our community, that's not something you could talk to with another Black man. Like, I can't go to another man like, look, hey, the doctors put 2 fingers in me. You need to go, get yours next. Like, you get clowned, you get laughed at. And it's bad to the point that, we worry so much about what other people think that we rather die than to go get this exam. So is there a different way to get this exam?
No. I think they may have precursors that you can check in your blood, but most time it's just the manual exam. They do have a precursor.
Manual. Okay.
And you shouldn't be afraid. That's part of your body. You should love your body. I know men have more of that taboo, somebody sticking their finger up there, but it's just for a quick minute.
I mean, yeah, I want to love my body. I don't want somebody else to love it like that.
But if you love your body and you have family or loved ones here, you want to be here for them. That's how I look at things.
Okay, fellas, go get your prostate exams at 40. Love yourself and let the doctor help you love yourself too.
Yes, definitely. Definitely, you gotta love yourself.
Find a place in your head to go. Just think happy thoughts. Okay. Now, this question is about food. Is our traditional soul food hurting us, and how can we make healthier versions without losing our culture?
Soul food's not hurting us. It's the way we cook it with the butter, the grease we use, fried, the lard, the salt, and everything. It's not the food per se. It's the way that we cook it. Instead of adding like all that heavy sugar and syrup to like sweet potatoes and staying away from white. Remember, white is not good for you to eat. Got to be colorful. So you want everything colorful in your diet. So white rice, white bread, none of that is good for you at all. So think about, this is what I found out when I went to this conference. When you go into the grocery store, think about it. If you look at the parameter of the grocery store, that's all your healthy stuff. Remember, you come in most time either right or left, depending what store, what's hitting your fruit, and then your vegetables. Then you go around to like your seafood, your meat, and then you come around to your dairy products, and then your bread. That's all your healthy parameter when you go shopping. When you go in between, that's when you start having the issues. You're going to see the chips.
The sweet stuff.
The sweet stuff. Even though you need detergent and all that. I'm talking about food-wise. Just think about when you go into a grocery store, how the parameter, just look at your parameter, how it's made. And that's where your shopping should be located around. It's the parameter of the grocery store. Okay. And the best meat is which I know in our communities, our Black community, we don't have the fresh counter person like, say, Whole Foods that cut the meat up when you go to the butcher area. That's the best way to get meat if you eat meat, is to go there. But they said if you go to the grocery store, get the package in the back of the pack because they're the more fresher ones.
Okay.
So.
Well, remember, folks, if it's white, it's not right. We need colored in our system. Okay. Why are Black women significantly more likely to die during childbirth compared to other races? And I didn't know anything about this.
Yes, we are. We very high to have problems with childbirth. Goes back to what is given to, even when they had the research with a Black woman on the same level as, say, a white man, same social and economic, same educational level, same living environment, it's still the Black woman have a higher chance of having a mortality with birth. And it goes to back to on the stress that they deal with, racism, fighting to be accepted, dealing with the environment out here. It's just stressful on the Black woman. Now, when you start separating the communities and you have the lack of prenatal care, taking the incident right in D.C., like I was talking about, prenatal care is limited. Also, just being having different stores available for them to eat appropriately, to have checkups done like they're supposed to, and just having a good hospital to help deliver babies. So in D.C., from Southeast D.C., never had a maternity ward from 2017 till basically now in 2025 of the November when the hospital opened, and there's still not a good functional maternity ward. People still were taking a risk of having to go all the way to GW with high risk. So it's a lack of availability to us in all the socioeconomics. We have the hypertension, the preeclampsia, cardiovascular heart disease related to having childbirth risk. So, and a lot of stuff can be preventable if we just had those things in our community of having prenatal care available.
We need more vitamins, more checkups. You need to stress. Okay, so I'm guessing having a good home environment and less stress would be helpful.
Yes, it would be helpful. But like they said, it's still something with the racism, stress, environmental stress that still affect Black women. We can make the money, we can have the best husband, the best environment, but that stress out there still affects us more when it
Mm,
comes to prenatal.
mm. Okay. Makes a lot of sense. So, what simple lifestyle changes can we start today to add 10 or 20 years to our lives? And I know this is a tough question because, like
Mm-hmm.
I said, you could have the greatest household, but as soon
Mm-hmm.
as you leave out with the people that's riding the bus break down, there's stress, the train, your job, is stress everywhere in the Black community. So, what can we change to add 10 or 20 years to our lives?
I'm going to say 10 and 20 years is mental. It's like you have to find somewhere to release, even it's meditation, praying, exercising, which I know is limited in our communities, but walking, having someone, it's nothing wrong having even a therapist. There are ways that you can get it. Have one. There are some therapists that do offer free counseling certain times in certain neighborhoods. I feel that we all at one time need to talk to someone because of the stress out there. Like you said, the bus breakdown, people go off and you're like sitting there, and that's like putting stress because either like I'm going to be late to work and I'm hearing these people carrying on. So it's a way that you have to learn how to decrease your stress, not hopefully not by eating or drinking or anything, because that will bring on more stress and more stress on your body. So either find a way to see therapy. And I know as Black people, we don't like to say we want to go to a therapist because we taboo. Oh,
That's a
they're
taboo.
crazy. They got some issue with their mind. It is nothing wrong talking to a therapist. Believe you me, it is nothing wrong talking to a therapist because they can even give you guidance. Now, that's when you have to find out what therapist clicks with you, and that's by interviewing.
So
Mm-hmm.
it's really good information to know that there are therapists out there doing this for free.
Mm-hmm.
I never knew about that, and like I said, I had to make the decision to go to therapy on my own because of the stuff I've been through. But the way I was raised with my mom, therapy was never a thing. Feelings was never a thing. Like, I look at these, shows with my daughter now and they're teaching them about feelings.
Mm-hmm.
If you feel this way, it's this, it's anxiety. If you feel this way, it's stress. If you feel this way, it's sadness. Like growing up, we wasn't allowed to feel in the Black community. I remember even when I told my mom that the words on the paper, like every time I try to do my math homework or my, English, the words kept moving around. Like, I would see 169 and I would read it as, 196. And, she would always say, boy, shut up. That's a white man's excuse. So that's how I was raised. Everything that I said was wrong. If, my vision was blurry, that's a white man's excuse. Or, it was always something to keep me from going to get the help I need. And I get it because she probably felt like everything would cost money. Even when I go to the doctor now, I go to the doctor for one thing. They send me to another doctor. That's another copay. Then that doctor sends me to another doctor. That's another copay. And I feel like this system is just designed to keep us down, keep us broke, and keep us afraid of going to the doctor.
I think if that's generational trauma that you were talking about there too, when the trauma, I don't know anything about your mother that she might dealt with and passed on. We all have certain traumas that are passed on that we don't go to the doctors because of financial or anything like that. But you have to take into account when the doctor give you, you can, ask more questions. It's all about asking questions. Why? Why do I have to do this? What you think, what made you feel that I need to go to this other doctor? What are you seeing? What are the results? Explain them to me, or explain the x-ray, explain the CAT scan to me. Let me see. And you have the right to ask those things. You have the right for them to pull the CAT scan up and you look at it and for them to explain it to you and what they're seeing.
So I want to understand about I understand everything you're saying, but I know for us, the major concern is the money, the copay part. So even with Kaiser, if I go to Kaiser today and see one doctor and they want me to go see another doctor on that same day while I'm there in the same building, why do I have to pay another copay if I never left?
Because that's two different doctors, two different specialties. I'm just telling you like it is. I'm telling you like it is. It's two different specialties. And it's hard for, I don't even know what to say it's middle class out there anymore. You caught in between that social economic, you make too much to get help from federal government, and the other prime PPOs cost too much
Yes,
to
it
get.
does.
So you're in between of having HMOs or something like Kaiser and them that's in between. So I know with Kaiser, you got to go to one doctor to another doctor because within the system. Anybody facing any health issues, insurance issues, if you have to look it up with your federal government or your state government, how to deal with Medicaid. If you fit that criteria, because that is the best insurance for low income is Medicaid. It's no other thing out there but Medicaid. And CHIP is a good thing because that's for pregnancy and for your kids that you can have if you fit within the income. And then if you like that in between income, it's the best to go to like the Affordable Care Act that Obama started. They have called Marketplace, which you can go and look at different insurances. They're supposed to be able to help you get the best insurance. And then you have the ones, the PPOs that cost a whole lot. And then you have Medicare is Medicare when you get 65 plus. But if you have prescriptions or another thing that is pharmaceuticals, is off the chart. So they have this thing called Good RX, which can help subsidize prescription.
Okay. So a lot of these insurance you mentioned can't, people with no jobs.
Your Medicaid.
Okay.
You can get Medicaid and CHIP. You can get CHIP. You can get Medicaid and CHIP. Also, if you have a job and you don't make over a certain type of income.
Okay, so it's for low income and people with no incomes.
Right. So and then that in between is that marketplace they call it. When you make too much and you don't make enough for the high expensive PPOs, you can go through the marketplace, and that's kind of bargaining through the Affordable Care Act. And then also I tell people when I have like some patients to always ask their doctor when they go in there to get these prescriptions that like, God, it's $300 for these pills. Always ask them, do they have a
generic brand?
Generic brand, first of all. And some doctors don't want you to have a generic brand because it depends on what your health issue is. Ask them, do the company have a coupon? They have a coupon for a company. Do we have a couple samples? And you can also call the pharmaceutical itself, contact them, email them, or call them, their rep, their customer service, and ask, do they have a discount on the prescription?
Well, I know for most of us, especially for myself, pride is a big thing. Like I feel like I work hard to get, everything me and my family needs. And I couldn't see myself telling somebody I couldn't afford something and asking for samples, even though I know I really need it. So I think it's just, a lot of stuff we deal with in our community. And I know pride is a big, because I just can't see myself begging. It's something my mom instilled in me. And I know it's not the right or proper thing to do, but she just was stuck on it. You don't beg, you don't ask for help, you do without. And I feel like we need a lot of help out here, and we're afraid to ask.
And that's true. And that's when you get, like we were saying, people come in with their hypertension uncontrolled or high blood pressure uncontrolled or diabetes uncontrolled or any other kind of health illness, because they are looking at, just like you were taught, one thing they might not know that this is out there, and that their pride. So, and also, what do? I need to feed my family or take this one pill? Do I need to keep a roof over my head? So it's a choice a lot that I find, because a lot of times we have a thing that, they're non-compliant or take their meds. But once you go and talk to them, it's not related to them not wanting to, is the financial part. And so that's when I start kind of offering that to them, because that's their life. I try to talk to them a certain way. But it's like they have a choice to keep a roof and food on the table for my family and skip a pill every other day or not take it. And so that's when you have them come into the emergency room, urgent care, with blood pressure or diabetes. Their sugars are 500 and their blood pressure 200 over 100. And that's really what you find out, is a choice of feeding my family and keep a roof or take these pills.
So my last question is, how can some of these countries like Panama, Canada offer free health care to their citizens, and we don't have that option.
That's to me, and I have talked to some people too, that is a 50-50 thing. By researching a little bit, those countries, they offer it, but they also is a waiting list for to get certain surgeries. And age and money can affect that waiting list.
So it's still the same system. It just, pretty much fucks us in a different way.
Yes. You got to remember that. Money always talk. You can get anything done in any country if money always talk. But when you have that national health, that comes to effect about you're going to be on a list for a surgery that you might need. Somebody younger might get it because they're younger compared to you might be a little older if you don't have the money to jump up to pay for it.
So even here, is it the same? Like, let's say I have free insurance, you have a PPO, and we both need the same organ.
It shouldn't be supposed to. You shouldn't be like that.
So money don't talk in that. I could be on Medicaid and still get a lung or a heart. Or
they're going to put it this way, they're going to find the money for you if you need it. One thing I'm going to say was working when I did cardiac, open heart recovery, we literally would have people come, I hate to say that, from other countries. Their family here knew they were sick, and they got them on a plane, and they got them here to the U.S., and soon as they got them off the plane, they brought them into the emergency room, and they got open heart surgery. Who do you think paid for that? The family didn't. So we do not, even though we need a lot of help with our health system, but we do still give out free stuff, put it that way.
Okay, well, I want to thank you for coming out today. I know you got your own podcast you're working on, so anything you want to say to the people, any information you want to give them, how can they reach you if they have questions? When will your podcast be airing? So,
okay, I'm going to start a podcast called The Equity RN, and it's going to be hitting on some of the things that me and Dion talked about, but I'm going to give you a little bit more legal aspect with it because I'm into the legal nursing part. You should be seeing my first podcast come out the second week in April. I have definitely a good board team with me that's going to be working with this podcast. So we're going to not only talk about health issues, we're going to talk about a lot of stuff related to the legal part of going to the hospital, the doctors, and also this is for nurses, doctors, everyone, because we're also going to be talking about nurses, them getting burned out also, and talk about that. So we're going to cover a whole line of stuff. So look for us in April. It's 3 beautiful women, but it's my podcast, Equity RN, Wenonah Baldwin.
Okay, well, thank you for coming out. I appreciate the information. I learned a lot today, and I hope our viewers did too. So until next time, this is Mistakes Make a Man. Enjoy the rest of your day.
Every decision has a story. Every mistake has a lesson. Before you judge a man's choices, understand the mind that made them. I'm not saying every decision is right, but who are you to judge a life you've never lived? This is Mistakes Make a Man with Dion FOBB REEP Caracciolo. Until next time, grow through what you go through.